Hello, Mayor Pugh. It is an honor to have the opportunity to speak to you about a core issue in the great city of Baltimore: food deserts. The Baltimore City Health Department defines food deserts as areas where residents must travel more than a quarter of a mile to reach a supermarket. The median household income is at or below 185% of the federal poverty line. Over 30% of the households lack access to a vehicle, and the supply of healthy food is low. Currently, around a quarter of Baltimoreans live in a food desert. Within this large group of people are 30% of the city's school-aged children and 34% of the city's African American population. The fact that 75% of corner stores do not sell fresh fruit means that someone who lives in a neighborhood like Sandtown, Winchester, where Freddie Gray was arrested, would need to walk at least 20 minutes to reach a real grocery store. Improvement in regards to food deserts would be an obvious step in addressing numerous public health concerns in the city, such as obesity, cardiovascular disease, and diabetes. I hope that this presentation will convince you to adopt a proposed solution to end food deserts in Baltimore City. Thank you.
One solution that could have an immediate impact on food deserts in Baltimore is improved public transportation. By providing public transportation to and from supermarkets with stops in known areas that lack access to healthy food, the city of Baltimore could shrink the percentage of citizens who are unable to access healthy eating options. First and foremost, this could be done by adding stops at supermarkets to already existing public transportation that runs through Baltimore City's food deserts. These areas have been carefully mapped by Baltimore City and the Johns Hopkins Center for a Livable Future in their Food Environment Map and Report of 2015. We also propose a shuttle that runs directly between areas that have been mapped as food deserts and supermarkets, called the Food Loop. This shuttle could be an immediate solution to the lack of access to healthy food in Baltimore's food deserts. As other long-term solutions are being developed and implemented, this could be a relatively easy plan to put in place and would provide immediate results for the citizens of Baltimore.
Transit updates are not a fix-all solution to food deserts, but it can help ease the effects of living in a food desert in a quick and short amount of time. Most food deserts are located to the east and the west of Baltimore County, where bus transportation is limited and infrequent, and people are living well below the poverty line, with very limited access to full-service supermarket. If you live in a food desert and do not have reliable access to your own transportation or car, then you have two options: walk to the grocery store and only buy what you can carry back, or rely on public transportation. If you get to the grocery store and you get stuck in the checkout line when the bus comes, then you're stuck there for at least another hour, and if you have frozen goods or perishable items that need to be refrigerated, they will go bad, and then you've lost money and time. In the past few years, the MTA has spent $135 million revamping bus routes in the city. It's called Baltimore Link, and it aids to better serve and connect the Baltimore County residents. However, it does little to solve the food problem that is still at the fringes of Baltimore County. We should work with the MTA to help change bus routes, add stops, and increase buses so that people who live on the outsides of the society and in East and West Baltimore can easily access supermarkets and get the food that they need. Specifically, we need to look into revamping the City Link blue, purple, lime, and pink routes. Other ways we can improve public transportation and increase the amount of people who can get to and from supermarkets easy is by partnering with rideshare companies like Lyft and Uber and subsidizing the cost of transport to and from supermarkets and grocery stores, or creating a volunteer-based shuttle program that allows county residents to call and schedule bus pickups to take them home with their groceries. Another thing that we could do is invest into mobile food markets, which leads us into our next proposed solution.
In terms of logistics for our healthy food trucks, we plan to partner with the Urban Real Food Farm located locally in Baltimore to buy fresh produce to stock the trucks. To begin, we will target two neighborhoods in Baltimore which we have identified as being the most in need of supportive public health measures. The communities of Middle East and Sandtown, Winchester can both be classified as food deserts and would likely benefit greatly from our program. With success, the program may eventually expand to include more neighborhoods. The food trucks will offer produce at prices 50% of those found in supermarkets. This is done to ensure that the healthy food offered can compete economically with the other food options that members of the community may have available to them, such as fast food, chips, or pizza. The vans will operate Mondays, Wednesdays, and Fridays and will run from 8 a.m. to noon and 4 p.m. to 8 p.m. These times were selected to allow flexibility for those who may be working multiple jobs or have busy schedules. Each neighborhood will have its own bus, and each bus will circulate between 2 stops. In Middle East, the food truck will stop at the Men and Family Center on Jefferson Street and the Door Baltimore Urban Leadership Foundation on North Chester Street. In Sandtown, Winchester, the food truck will stop at Gilmore Elementary School on North Gilmore Street and the Easterwood Sandtown Park and Playground on McKean Avenue. These sites were chosen for their proximity to the citizens who would most benefit from the food truck. Additionally, on Sunday mornings, the food trucks will loop to various churches in the neighborhoods to sell produce and provide information on healthy eating. Our budget for this program in its first year would be approximately $200,000. We would hope to obtain this funding through grants from the state and local governments, and we would also campaign for donations from private individuals or local companies. Of this budget, approximately $110,000 would be dedicated towards purchasing the fresh produce to stock the trucks. We would plan to hire 4 part-time employees, either local students or community members, to work approximately 14 hours a week each. At $20 an hour, about $60,000 would be committed to the collective wages of these workers. 2 vans could be purchased for about $10,000 each, and the remaining $10,000 of the budget would be reserved for gas money and variable costs associated with the program. We see this Baltimore food truck program as a feasible measure to address the issue of food deserts and malnutrition evident throughout many of the neighborhoods of Baltimore.
It's easy to look at statistics and realize areas that have limited access to fresh produce have a significantly greater obesity population than communities that have access to fresh produce conveniently. However, introducing an easy way to access produce is only one of the factors that needs to be implemented. The evidence supporting the elimination of food deserts as a strategy to reduce disparities in diet equality is weak. As seen in a 2009 study of the effect of socioeconomic status on supermarket purchases, individuals of low socioeconomic status were more likely to purchase unhealthy food, even in the presence of accessible healthy foods, thus indicating food deserts are not the crux of the problem, but more of a superficial issue. I believe a multi-purpose program similar to the needle exchange truck would be beneficial to the community suffering from high obesity rates in food deserts. While providing a service of cheap produce to community members, we can also educate them about what a healthy diet looks like. By slowly implementing healthier, more accessible foods, along with information about how to utilize these resources, low-income families not used to providing nutritious food to their children can incorporate these lessons into their household. Hopefully, this will propagate a healthy food culture that can be passed
Issue
on.
of food deserts. The Baltimore Food Policy Initiative currently employs 5 separate strategies. The first is attempting to retain and attract supermarkets and grocery stores to these areas by offering financial and funding and tax incentives to those that aid in mitigating the issue. New food stores that locate in these areas are eligible for a 10-year tax abatement on personal property taxes, and existing food stores are eligible to receive personal property tax credit for renovations. Second, they look to improve non-traditional grocery retail options, such as converting existing corner stores to increase availability of healthy food options. Third, they look to improve the availability of healthy food in Baltimore's public market sector to maximize the impact of Baltimore's 6 public markets and create synergies in purchasing, staffing, and maintenance. Fourth is addressing gaps in transportation that impact food access, which includes making public transit more conducive to shopping for food and supporting innovative strategies and organizations creating transit-related solutions, such as the ones that we've mentioned earlier in the video. Fifth, the BFPI supports innovative models to strengthen and amplify the food economy, which includes structural changes in supply chain and distribution to make it more favorable for small businesses to increase the impact of food-based businesses in the Baltimore.